Hello everyone, we are Group 6 of Psycholinguistic Class B from Udayana University, Bali. Today we would like to present to you about aphasia. Our group consists of Desani Aphasia, Nimade Aurelia Wahyu Batari, Tamara Victoria Utomo, and Esther Odelia Humanities. Hope you will enjoy our presentation. So, first I'm going to introduce you to aphasia. According to National Aphasia Associations, aphasia is an impairment of language that affects the productions or comprehensions of speech and the ability to read or write. It usually happens because brain injury, most commonly from stroke, but it can be seen with people with neurodegenerative diseases such as Alzheimer's, brain tumor, and vascular dementia. Aphasia limits the ability of someone to communicate, but it doesn't affect their intelligence. People who suffer from aphasia may have difficult time to find the right words that complete the thought in their mind, and hard for them to speak for it. And continue to history of aphasia. Aphasia came from Greek word a and passes, which meaning is speechless. In literature from the Roman era, aphasia was shown through authors like Soranus of Ephesus that noted the impairment of speech following paralysis on one part of the body. Some authors in the 18th century, specifically Citron and Gessner, attempted to understand language disorders. There's also a great debate on the late 19th century on the functional and anatomical aspect of aphasia, leading to cognitive neurosciences. Language processing in this era was defined as simple, functional model of word production and recognition. And in early 20th century, the discussion of this language disorder was diminished because of the decreasing interest in localization issue. Aphasia then became a primary clinical issue of the best way to identify a patient.
Forms of aphasia. According to Penggali 2014, there are three categories of aphasia depending upon the quality of the deficit acquired. So the first one is fluent or rhenic aphasia. This aphasia results from pathology in auditory association area of the left hemisphere. So these aphasic individuals have little issue with fluent verbal output, but have difficulty in the language that they are speaking. The second one is non-fluent or burqa aphasia. This aphasia is associated with damage in the Broca's area. Speech in this aphasia is not fluent, but language understanding is relatively normal. The last one is alexia. So this aphasia refers to an acquired disorder in reading caused by brain pathology. So brain pathology frequently is associated with the reading ability.
The next one is the types of aphasia. The first one is Broca's aphasia. This aphasia is also known as expressive aphasia. It's where the patients lost their partial of language production capacity. It means that the patients know what the other people say, but sometimes the patients cannot give the feedback to the other people. And for the signs of this aphasia are misarticulations and distortions. He said that the signs of this aphasia are sometimes the patients cannot form the complete sentences, and also usually patients cannot articulate the sounds and the words well, and sometimes the patients cannot write and read something. And for the cause of this aphasia is caused by the damage to the brain on the left front. And the other causes of this aphasia are stroke, brain injury, brain infection, even the Alzheimer's disease. The second one is global aphasia. This aphasia is the most extreme aphasia and applied to patients who have the few identifiable words and understand a little bit of the spoken language. And for the signs of this aphasia happens usually after the patients suffer the stroke, and after that the patients have no understandable words to speak. And for the cause of this aphasia is caused by the damage to the brain on the left side. The third one is transcortical motor aphasia. This aphasia is non-fluent aphasia. That means that the patients who suffer this aphasia have a lot of starts and stops space in the speech. And for the signs of this aphasia are usually the patients have difficulty to find the words and sometimes missing the both of intonations and the rhythms. And for the cause of this aphasia is usually caused by a stroke that affects to the Broca's region.
Wernicke aphasia, the most common, which occurs when the left center side of the brain becomes altered or damaged. Wernicke is a familiar designation in this area of the brain named after Carl Wernicke. And the next is the conduction aphasia. It has fluent disturbance caused by the damage to the left hemisphere of the brain above and below the posterior sylvian fissure. Auditory understanding remains fairly intact in individuals, with most of the speech production affected. And the next is anomic aphasia. It occurs partly as a result of the destruction of the language area outside the perisylvian circle. Difficulty in searching or choosing words is a characteristic, but still have a good speech skill and relatively preserved language understanding. And the last is the transcortical sensory aphasia, or TSA. It involves damage to the temporal lobe of the brain. Symptoms include poor hearing, relatively intact repetition, and fluent speech but with semantic paraphasias. TSA is similar to the Wernicke aphasia. Well, that's all our presentation. Thank you very much.